Okay, thank you so much. Thank you. Okay, so good afternoon, all of you, to all the eminent doctors who have joined us today. First of all, thank you so much for joining us on today's webinar. So our endeavor is to spread the awareness about the rabies, which is a fatal but can be avoided once appropriately vaccinated. This is an initiative from Cadila Pharma through its innovation to serve the society as well as the humankind. So the topic of webinar today is a dosage reduction strategy in rabies management, role of novel vaccine. Dear doctors, as you are aware that ThRabis is the world's first novel 3-dose anti-rabies vaccine, and with a great pride, we would like to inform you that ThRabis has successfully completed 1 year of launch, and with more than 40,000 animal bite victims being vaccinated with ThRabis, with 100% compliance was recorded and no case of ADR was registered. With this, sir, I would like to welcome Dr. Vinod Porwal today, who is a MBBS as well as a MD, and he has a 20+ years of a rich experience in emergency management, ICCU management. He has presented the paper in API 2005 in clinical profile of a conclusion. Besides that, he has also attended national conferences in cardiology. He has also attended conferences in nutrition and health and diseases. He has also attended as well as a chaired APCon, CSICon, critical care, HSCon, and presented papers in many more conferences and published 9 papers as on today. Currently, he is associated with the SAIMS Medical College and Hospital at Indore, and he is a professor over there. So over to you, sir.
Thank you, Shantanu, for the introduction. Shall we wait for a while for the attendance to join, or should we start?
Sir, we can start, sir.
Okay.
So for this webinar, sir, we have 50+ registrations are there currently. 56 registrations are there, and we also received in advance some of the questions from the registers doctors itself. Okay, so we can start the webinar, sir.
Okay.
Yes, sir.
You are going to share the slides?
Yes, sir. Yes, sir.
This is visible, sir.
It's visible, na?
Yes, sir.
Yeah.
Thanks everyone, and thanks Cadila for giving me this opportunity. I'll start the video. So today our webinar is on the dosage reduction strategy in rabies management. Actually, as we all know, rabies, it is a zoonotic disease caused by the bite of the ये slides आगे क्यों आ रही है? Okay, it is caused by the dog bite. Okay, where as per the convention we need 5 vaccines, and it is the only vaccine preventable disease. It can be no other treatment is there for the rabies. Once we are infected or once a patient is infected, there is no treatment. He has to be given vaccine. That is the only treatment available so far. So what was there with the other vaccines? The other vaccines which are available till today or up to 1 year ago, before the rabies was launched by the Cadila, it was given in the doses of 5 doses. But the Cadila person, they have launched the novel 3-dose anti-rabies vaccine that is definitely going to help everyone. So we'll start with the introduction of rabies and how this rabies spreads and how we can prevent, and we'll discuss how the newer vaccine, it is superior to the other vaccine. Second slide. As we all know, the rabies, it is a zoonotic disease which is caused by the rabies virus, and here the 5 structural proteins which are encoded by the virus, they play a key role in developing the vaccine. The G protein, it is the major antigen in the formation of the neutralizing antibody. So most of the vaccines, they take help of this G protein. It has got N protein, P protein, M protein, L protein, envelope antigen, and RNA. But most of the time, this G protein is being utilized in development of the vaccine. If we go for the epidemiology, globally around 60,000 rabies deaths are there, which are mostly preventable, which are mostly can be taken care. And if you take a toll of our India, almost 1/3 of the deaths in the world accounts in India, 20,000 rabies deaths per year. And it is 90% in the rural area. As I told earlier, rabies, it is 100% fatal, but to be taken in mind that it is 100% vaccine preventable disease. So always ask the patient to take vaccine in the full doses. Just the evolution of the rabies vaccine, how it started. It goes back to 1885, where live attenuated vaccines were given and were developed from the spinal cord, but they were non-standardized, dried preparation were there, and almost 31 injections were given of increasing immunogenicity were given. Means we have to increase the dose of the vaccine day to day. And another was developed by from the brain. It was inactivated vaccine. They had minimal neural content, and they were available in liquid preparation. They were given 14 doses. And the newer vaccines, they are cell culture vaccines or cell deployed vaccines. They are inactivated vaccine. They have got standardized immunogenicity and lyophilized. They are given in the dose of the 5 injection that we are using nowadays. But the challenge is with this 5 doses. Current rabies vaccines are cell culture vaccines, inactivated, and this technology of the cell culture vaccine is almost more than 50 years old technology. And there is decreased compliance beyond 3 injections that we'll see in some of the studies they are done in the Bangalore that we'll get in the next slides. In this slide, we can see these are some of the studies done after 3 injections. In the 4th injection, almost 30% to 47% they left the 4th injection. And in 5 injection, the 5th injection, the 5th dose, it was missed by 40% to 54% of the people. Means almost half of the patient, they miss the 5th dose or 4th dose. So the incomplete vaccination is being done. So there is decreased compliance beyond 3 injection. It is the major issue. Non-compliance is the major issue here. Next slide. So meeting the unmet, it was a medical need. It was a medical urgency to develop the vaccine, which was required in the lesser doses. Lesser span was there because the earlier regime, they started 0, 3, 7, 14, 28, 90 days, up to 28 days or up to 90 days. So up to 1 month, the patient has to wait. There are so many issues are there, financial issues, time issues, salary issue, wages issue, that they cannot comply. So it was a medical need to introduce a novel vaccine, which was simple and a shorter regime was there. So the Cadila people, they have come with the rabies vaccine, which is got only 3 doses to be given, and it is tested, and it is first protein subunit vaccine prepared from VLP platform technology. It is the first vaccine with 3 doses, which are given intramuscular. 0, 3, 7, 14, and 28 are not needed. Definitely, as the regime is only 3 doses, it is completed. It is getting completed in a week. So there is a better compliance due to easy flow regime and less visits to the hospital. It is one more thing is that it is ready to use. No reconstitution or no dilution is being needed. So the novel vaccine with novel technology. Okay, it is developed with VLP technology. How it is being done? The G protein is difficult to stabilize. So G protein isolation was done by the Cadilla people using VLP technology. It was purified and stabilized. These VLPs are protein and exist as a nanoparticles. They are similar to the native virus particles, but do not contain the viral genome. They do not contain the viral genome, means definitely the risk of developing side effects, the risk of developing encephalitis, it goes down. And again, they cannot replicate because they don't have any viral genome, but can mimic the viral antigenicity without being pathogenic. So the pathogenicity, the developing of rabies because of this vaccine, the developing of encephalitis, everything is being prevented. And definitely they are VLP, they have G protein, so they are capable of inducing a stronger humoral and cellular immune response like all the vaccines. Next slide. This VLP technology. This was the original research article published in June 2021 by Sumit Poddar, Ashok Agarwal, Ajit Soni. This was about the VLP based and another VLP based rabies vaccine. Original article it was produced. So the in this this VLP technology or this vaccine has got clinical phase 2 trials also. Study design was there with the RABIES and the VLP. So when 0.3 doses of this any of the vaccine, either VLP or RABIES was given, the up to day 14 the effectiveness was there with all the kind of vaccines. Means ki either and in 0.37 days post immunization, the almost the same seroprotection was there, and in 0.37 even the 50 microgram was given, means 10 microgram 0.37, 50 microgram 0.37, the almost same seroprotection was there up to 90 days. Okay, but when we go to the RABIES 2.5 international unit, just a minute. Go to the yes, go down. When we go up to the 180 days, here the immunogenicity or the seroprotection it goes down with the 0.37 doses of RABIES or others. But here it remains there even with the low doses. Means this is 10 microgram. This is the 10 microgram of 0.37 here. You can see of the RABIES. Just a minute, ये slide इधर पीछे कुछ और है day 270 वाला. And at day 270, the immunogenicity of this one, okay, 50 microgram of 0.37, it remains, it is up to the peak, where all other, even this RABIES, 0.3 doses of low dose of RABIES, low dose of our ThRabis, it goes down. But when we give low dose of our ThRabis, the immunogenicity or the seroprotection remains up to 270 days. It was being done in the clinical phase trial too. Next slide. This was the safety and immunogenicity of the novel. Immunogenicity we have discussed. Safety we'll discuss. Of the novel 3-dose recombinant nanoparticle rabies G protein vaccine, it was done in 2021 November. A randomized comparator controller multicenter phase 3 clinical studies was done. Next slide. It was the phase 3 study. It was done to evaluate immunogenicity and safety of rabies G protein vaccine. The ThRabis vaccine administered as a simulated post-exposure immunization in healthy volunteers. Okay, total 800 subjects were taken. Randomization was 2:1. 0.37 regime. in 037 regime, 533 subjects were taken. In 037 1428, 267 subjects were taken. That was, and this regime 037 1428 was done with the help of Rabipur. And here 037 was done with the help of the rabies vaccine. So our study design and the objectives were to demonstrate the non-inferiority of the test vaccine, means the RAB, to the comparative vaccine, means the Rabipur. And the primary objective was with the subjects with seroprotection at 14 days post first dose, means after first dose seroprotection was there, up to 14 days was not there. That was to be studied. And secondary objective was subjects with seroprotection at least 42 days post exposure first dose of test vaccine, and safety by monitoring subjects with adverse events. Seroprotection, here we can see on day 14 and day 42. The results, here we can see the efficacy. It was comparable, 100 and up to 99.24% in the rabies, and 97% 14 days seroprotection in the reference or the Rabipur. It was at par with the Rabipur on the first day. And even if we go for the 42 days seroprotection or the presence of antibodies, here we can see in the RAB 98.64, 98.6 point, comparable to the rabies, the Rabipur vaccine, it was 100%. Means the seroprotection 14 days and 42 days is almost same. Means the efficacy is same. So we can conclude that the results were consistent across different age groups and genders. Observed difference was 1.52% with the pre-specified margin of 4%. So we can say that it is non-inferior for seroprotection. Primary endpoint day 14 and 42 were met. Test and compares are identical in seroprotection rate, both on days 14 and 42. And coming to the safety profile of our vaccine, we can see only 9.9% of the patient, they develop adverse effect with our new vaccine, ThRabis, while almost double patient develop some adverse effect with the Rabipur, 9.9 and 72. Local adverse effect we see in the form of localized pain. It was there in 7.69% in the ThRabis vaccine, while in Rabipur it was 13.56. Redness, inflammation was seen almost comparable, but it was less in the ThRabis, 2.8%, while it was in the Rabipur, it was 3.37%. Swelling, definitely it was less in the ThRabis vaccine, 0.75% of the patient developed swelling, while around 2% of the patient developed swelling in Rabipur. This was about the local adverse events. When we see for the systemic adverse effects, like fever, headache, earache, urticaria, joint pain, nausea, at every place, our ThRabis, it was better compared to the Rabipur. We can see fever was there in almost 0.4% of the patient, while it was 4 times higher in the Rabipur arm. 1.5% of the patient developed, while it was 0.4%. Ear pain was somewhat higher with our ThRabis vaccine, while we can go for headache. Definitely, very less number of the patients developed headache. Very less number of the patients developed joint pain, nausea. Okay, so we can conclude that the rabies has a better safety profile and significant less adverse effects as compared to the reference vaccine. So the study conclusions were there. Our new novel anti-rabies vaccine, 3-dose anti-rabies vaccine, ThRabis, is non-inferior to the reference vaccine. It has got less adverse effects compared to the reference vaccine, and it was found to be safe and immunogenic and was comparable to the 5 doses of WHO pre-qualified vaccine. these are some awards given by the Economic Times and the Global Tigers Award in the Malaysia for the Innovative Product of the Year 2023 and Pharma Innovation of the Year 2023 to the rabies vaccine and the Cadila. Thank you.
Sir, we have some questions in a comment box itself.
Okay.
So one question was there from Dr. Uday Kulkarni. So he has asked, what about the pre-exposure prophylaxis and how many doses would be there for that purpose itself?
Pre-exposure prophylaxis.
Yes.
Yeah, pre-exposure prophylaxis we recommend 0, 3 and 7. But once someone has received 0, 3, 7 in lifetime, the need of the rabies immunoglobulin, it is not there. So we advise everyone who is in contact with the animals, who are working with the pets or who are running dog clinic, they should get the 037 dose, and subsequently every 5 years or so they can get a booster dose.
Okay. Sir, there is one more question received from Dr. Yogesh Chandra. So he was asking about that do dog bites regularly vaccinated dog requires rabies vaccination. So if the dog is, we have already vaccinated a dog, and if that dog has bitten, then do we require to take a rabies vaccine in that perspective? That was a question from him.
That depends. If the dog is previously vaccinated and we are very sure that he is vaccinated. Sometimes they said that it is vaccinated, or the attendants they said that it is vaccinated and there is no harm to you. That is our choice. But as far as our clinical practice, we usually give vaccine to them.
Okay. So there's one more question, sir. What are the signs and symptoms generally you see in a rabies patient itself?
Rabies patient?
Yes, sir. So when the patient approach to you and they come to know that it is a rabies, what are the signs and some symptoms you see generally in the patient itself?
Actually, they approach very late. Once the rabid dog has bitten someone, rabies bite is there, okay, and someone is not vaccinated, they will develop the symptoms 10 to 14 days and even up to 20 years of rabid bite. So we have to take in notice that up to 20 years the patient can manifest, and the manifestations are very typical. They will have dysphagia, they will go away from the water, they will not drink the water, and they will have perspiration everywhere, like sympathetic overactivity will be there, they will be perspiring, they will be hiding away from the water also, and dysphagia will be there. Some grunting sound is there. Fever, encephalopathy, seizures, they can come. Means encephalitis like features are there.
Okay. So there is one more question, sir. So what type of animal generally you see that when the animal bites, which comes to you and which has a ability to develop the rabies besides dog?
Besides dog, 90%, 95% of the patient are dog bite, but bat, cat scratch could be there. Any mammal which can cause.
Okay.
But bat is there and cat is there.
Okay. Sir, one last question, sir, from our side. So as a Cadila Pharma serving to the human society, we come up with this product of ThRabis, which has a novel 3 anti-rabies vaccine. So what do you think about your past experience as well as exposure of a rabies patient which comes to you, and after that you used to give them 5 doses, and then there is a regime which is to follow and compliance to follow. So what do you think about the ThRabis in the totality overall? We would like to seek your feedback, sir.
Definitely. We are very thankful for the Cadila for developing this novel vaccine, because the span of previous vaccine, it was going up to a month. So means the patient was busy for a month. Now he is free within a week. And as we all know, this disease, it is only be prevented with the help of vaccine. There is no treatment. We always recommend to take vaccine in full doses. So earlier definitely the drug compliance or the dosage compliance was not there. Almost 50% of the patient, they were not having any follow-up after 1 or 2 doses of the vaccine. So it is going to definitely help, and we have already started giving to the patient. We are already started prescribing this one, and almost a year has gone.
Thank you so much, sir. Thank you for giving us a time. And I would like to thank entire audience as well as that joining us for this webinar. This is a very informative talk, which is given by Dr. Vinod Porwal. And we would like to extend heartfelt thank you for Dr. Vinod as well as the audience who has joined for this webinar. And we truly appreciate your efforts, sir. Last but not least, sir, that we would like to inform you that along with the audience, that ThRabis has also won the 2 prestigious award in the innovation category of 2023 for the ET, that is a Pharma Innovation Award, as well as a Golden Globe Tiger Award. Thank you so much for joining this webinar. Thank you so much, sir. Thank you.
Thank you. Thank you, Shantanu.
Thank you, sir. Bye.
Thank you.